So before I enter the room, I'm gonna wash my hands. Hi, Mrs. Smith. I'm Shona. I'm gonna be your student nurse today. Is it okay if I do an assessment on you, take some vital signs, and ask you some questions?
Yeah.
Okay. So I'm gonna go wash my hands and I'll be right back. Okay, so I'm washing my hands. Okay, so I'm gonna start with some questions. Can you tell me your name and date of birth?
Katie Smith, 3/14/68.
Okay. Looks correct. And I can tell that you're female. What brought you into the hospital today?
Stomach pain.
Okay, and do you have any past surgeries?
Yes.
Okay, can you tell me what those are?
Kidney tumor and my gallbladder removed.
Okay. Do you have a medical history of like hypertension or diabetes?
No. Kidney stones.
Okay, can you tell me your race or ethnicity?
White.
Okay, and do you have any allergies to medications or food?
No. Oh yeah, Demerol.
Okay. And your code status, do you want it to be a full code or do you not want any life support measures?
No life support.
And do you smoke or consume alcohol?
No.
And are you currently taking any medications or vitamins?
Vitamin D3.
And are you currently having any pain? If so, can you rate it on a scale from 1 to 10?
No.
Okay, so for charting purposes, I would take a look at your physical appearance. And you are clean, you're not curled up in any pain or anything. And as far as body structure goes, everything looks good, no missing limbs or slumping posture. Some possible safety issues though, possibly the spur rug, you could fall. Everything else looks good though. For your behavior, I would say that you are alert and you're pretty oriented. Have you had any mood changes lately?
No.
Okay. And do you feel safe in your home?
Yes.
Are you feeling dizzy or unsteady when you get up?
No.
Okay. So that's all I have for your survey. I'll be back in just a second and I will do some vital signs on you. So I've done my hygiene for entering the room again. Hi, Mrs. Smith. I'm back to do your vital signs on you. I'm going to wash my hands and I will be right back. I'm washing my hands and I'm putting on gloves. So I'm going to make sure the bed's at a good working height. I'm going to put the bed rails down. So is there any reason that I shouldn't take your blood pressure in either arm?
No.
Okay. So I'm going to put the blood pressure cuff on this arm, line it up with the artery, the air that's on it. I'm going to find your pulse. And what does your blood pressure usually run?
140/74.
Okay. So I'm going to make sure the valve is closed and I'm going to pump it up till I hear the first heart sound and that'll give me my systolic. Then I'll let the air out, and when I don't hear the heartbeat anymore, that'll give me my diastolic. Okay, so I got you at 137/72. I'm going to take your blood pressure cuff off. Go set that over here. Now I'm going to do your pulse ox, so I'm going to go get the machine really quick. Okay. So here's this little device. I'm going to get it on your finger. It's good that you don't have any nail polish. Okay, I'm going to let that read. Okay. And I got you at 100. Okay, and now I'm going to take your pulse. I'll do this for 30 seconds and multiply it by 2. And secretly, I will be getting the patient's respirations while I'm doing this, and I will do that for a minute. Okay, so our minute is up. I got your pulse at 64. Nothing was irregular. It all sounded good. And your respiration's at 20. Nothing was labored. It seemed like your breathing was pretty easy. Now I'm going to take your temperature. I'll go get the thermometer and I'll be right back. Okay, so I'm cleaning it with an alcohol swab. And are you okay to hold it in your mouth yourself?
Yeah.
Okay. I'll have you open your mouth. I'll put it on your tongue, bite down. I'll wait for that to read. Okay, go ahead and let go. Okay, now we'll clean that off and with the alcohol swab, and I will put it back up. And I got you at 36.3 degrees Celsius. Okay, so I got all your vitals done. Now I'm going to do a skin assessment. I'm going to go wash my hands and put on my gloves really quick, and I'll be right back. Okay, so I'm washing my hands. I'm putting on my gloves. Okay, Mrs. Smith, you ready to do your skin, hair, and nail assessment?
Yeah.
Okay. Your skin looks normal for your ethnicity. No ashiness or anything. And your skin temperature is good. I checked that pretty much when I looked at your bracelet. Nothing's cold. And your skin is intact. There's no bruises or lesions that I can see so far. If this was a real patient scenario, I would remove the clothing and I would check everywhere on the abdomen and the breast area, under the armpits, and underneath the arms and everything, and make sure everything looks good. Now I'm going to go ahead and bring the blanket. Actually, I'm going to bring it up. And I'm going to check your toes. I would check between each toes after I remove the socks. Make sure there's no bruising or lesions, no dry skin. And I would do that for both of the legs. Everything looks smooth and no dry patches or anything. I would go in the vaginal area. But for the sake of the video, we're not going to. Now, are you okay to roll over on your side?
Yeah.
Okay, so I'll go ahead and have you roll over on your side, and you can hold on to the side rail. And I'm going to check your back and everything for the same reason. No breakdown or lesions, dry skin. That all looks good. And I would check the buttocks area. It looks all good. And then the back of the legs. And everything looks good. The heels. Okay, and I can go ahead and have you roll back on your back. So everything looks really good. Okay, so now I'm going to check your hair. I'm checking for dry skin, dandruff, any lice or anything. Use a pen light. And you don't have any alopecia or anything, so that's good. Okay. And when I checked your skin, I saw that, there's no hair in places it shouldn't be. Everything looks really good. Now I'm going to take a look at your mouth. If you want to go ahead and open up. So the tongue looks moist and pink. There's no white patches or anything. And all the teeth are intact. Cheeks look good. Everything looks really good. Okay. So now I'm going to check your nails. Make sure they're not dry or brittle or anything. And I'm going to press on them just for checking circulation. Everything looks good. And I would check both sides. And then now I'm going to check your toenails. I'm going to be checking for fungus or brittleness or anything. So I would take your socks off and I would do the same thing for circulation. Press on them. Everything looks good. So have you had any issues with your hair, skin, or nails lately? Have you noticed anything?
No.
Okay. so now I'm going to do your cardiovascular assessment. Have you had any dizziness or tingling, any numbness?
No.
Okay, any chest pain?
No.
Okay. So now I'm going to listen to your heart sounds. There's 5 parts of the heart starting at the top all the way down to the side. Just going to be listening for any heart murmurs or anything abnormal, and normally I would do it on the patient's skin, but for the video I'm not going to be doing this. And in the last spot I'll take your apical pulse. Okay, so your apical pulse was 63. Can write that down really quick. And there wasn't any abnormal heart sounds, so everything sounds good. Okay, so now I'm going to take your pulse just to make sure that they're nice and normal. They're not pounding or completely absent. So I've already done your radial earlier. So I just need to do your brachial, the dorsalis pedis, and your tibial. Okay. So I'll start with the brachial. So it's nice and strong. So that one's good. We'll do your tibial. And for the pulses, I'll do them on both sides just to check for symmetry. That one's good. And then the dorsalis pedis in the top of the foot. That one's good as well. Okay. Okay, so everything looked and sounded really good. I've already checked for edema in the skin assessment, so you didn't have any swelling or anything. No pitting problems, and I already did your capillary refill earlier as well, so you weren't cyanotic or anything. Everything looks really good. So now I'm going to do your respiratory assessment. I'm going to be listening to your lungs. Have you had any mucus or a cough?
No.
Okay. Have you had any problems breathing?
No.
Okay. Okay, you don't have any oxygen ordered, and you don't have a mask or anything. Have you had the influenza vaccine this year?
No.
What about the pneumonia vaccine? Okay. And do you use an inhaler?
No.
Okay. Okay. So basically I'm going to be listening for any crackles or any abnormal signs, any wheezing. And I'll also observe like symmetry of the chest, make sure you don't have a barreled chest, which you don't, or anything. That's usually a common thing for COPD. So far, visually, everything looks good, so let's go ahead and listen. So now I'm going to listen to your lungs. I would start on the patient's right and go from right to left, and then go down and over, down and over. And this I would do directly on the skin as well, but we're not going to again for the video. So I'll have you give a deep breath in and out. Okay. Again. Okay. Everything sounds good. No wheezing or crackles or anything. I forgot to mention that on the front side there are 5 points that I have to listen to, and then on the back side there are 9 points that I need to listen to. So for this, we have no way to put the head of the bed up to help you listen to the back, so I'm just going to have you can either roll over or sit up, whichever you want to do. So we're going to start at the top. I'll have you breathe in and out. Again. Okay. Okay. You can go ahead and roll over. Everything sounded really good. I'm going to go write that down. Okay, so now I'm going to do your gastrointestinal assessment. So I just have a few questions for you on this. Have you had any nausea, vomiting, constipation?
No.
Okay. Do you have any supplements or changes in your bowel functioning?
No.
Okay. And what type of diet do you have? Do you eat like fast food? Do you cook at home? Lots of vegetables?
Lots of vegetables at home.
Okay. And are you vegetarian or do you eat meat?
I eat meat.
Okay. So that's all my questions for that. Now I'm gonna take a look at your abdomen and also listen to your bowel sounds. Make sure they're normal and not absent or anything. So set this here. So normally I would pull your shirt up and everything, but we're not gonna do this for the video. Okay. So on inspection, everything looks okay right now. So now I'm just gonna listen for anything strange. And we're gonna do in like 4 quadrants. So we'll do the upper right, upper left, lower right, and lower left. Okay, they sound normal. They're not like absent or anything. So that's good. Now I'm going to palpate each quadrant. Make sure there's no masses or anything. Okay, and now I'll percuss. You're not having any pain or anything? Okay. Okay, everything looks and sounds really good. Okay, so now I'm going to do your neurological assessment. I'm going to grab my clipboard. Okay, so you are awake and you're alert and oriented. Can you tell me today's date and where you're at?
October 15th, 2020, in the hospital.
Okay. Can you tell me who the President of the United States is?
Donald Trump.
Okay. So I would say you are alert times 4, and set this over here. I'm gonna test your grip strength, make sure it's equal. If you're gonna grab my hands and squeeze as hard as you can. That was really good. Okay. I'm gonna check your eyes. Okay, and I'd say your perla is at 3 millimeters, which is good. Okay, so now I'm going to do your musculoskeletal assessment. Have you had any weakness when walking?
No.
Any trouble walking at all?
No.
Okay. So I'm going to do flexion and extension, abduction and adduction, supination and pronation. Just of your arms to just make sure you have full movement. And if you have any like discomfort or anything hurts when I'm doing it, just let me know. So we'll do flexion and extension, then abduction, abduction, then supination and pronation. We'll go around. We do each finger back and forth. And then you do your feet and your legs. And I do it on both sides, but doing this for the video. So, flexion and extension, abduction, adduction, and then I'm going to go in with your knee. I'm going to go, and then you turn the ankle in. Okay. Then we do your foot. So the flexion and extension, then side to side and around. And we do each toe after taking the socks off. So there was no pain or anything?
No.
Okay. So everything's good. I would document that as a +5 because you had a full range of motion and full strength. Okay, so for your genitourinary, I would just be noting the intake and the output for urine, and do any like Foley care. Have you had any like burning when urinating or problems urinating?
No.
Okay. Have you had any problems with your hearing, vision, touch, smell, taste?
No.
Okay. Okay, so for your psychosocial assessment, how do you feel about your health situation? Are you dealing okay with it?
Yes.
Okay, and how would you rate it on a scale from 1 to 10?
1.
Okay. And do you have any like anxiety about it? Does it make you scared?
No.
Okay, can you rate that on a scale from 1 to 10?
1.
Okay. Can you tell me your marital status?
Divorced.
Okay. And have you ever felt so blue that you thought of hurting yourself?
No.
Okay. And can you tell me a little bit about like your culture or your beliefs? Do you have like a certain denomination?
Pentecostal.
Okay. Okay, do you feel like you need any more information about how to treat yourself at home when you get home, like with your medications or anything?
No.
Okay. And as far as your understanding of your health situation, how would you rate that on a scale from 1 to 10?
1.
Okay. Okay, so I'm going to put your bed back down to the low position, put your bed rail up, your call lights in reach. Anything else I can do for you before I go?
No.
Okay, you have a good day.
Thank you.
I've documented all my stuff. I'll take off my gloves and I'll wash my hands.